My name is Reality Check and I will talk today about rabies. Rabies is a neurological disease caused by the rabies virus of the Lyssavirus genus of the Rhabdomyridae family. The rabies virus is a neurotropic virus that travels to the central nervous system from the periphery. Morphologically, it is bullet-shaped with spikes composed of glycoprotein G at the surface of the lipoprotein envelope. Its RNA is of negative sense and single-stranded. The RNA genome encodes for 5 genes: nucleoprotein, phosphoprotein, matrix protein, glycoprotein, and viral RNA polymerase. Upon receptor binding, the virus enters its host through the endosomal transport pathway. Both receptor binding and endosomal transport is mediated through the expression of glycoprotein. When the virus has fused with the cellular membrane through endosomal transport, the transcription and replication can now start. This process is catalyzed by the viral RNA polymerase. Once the virus has replicated in the muscle tissue and cells, it can now travel via the sensory afferents or motor efferents towards the dorsal and ventral root in the spinal cord. From there, the migration continues toward the central nervous system via the retrograde axonal transport. Well inside the central nervous system, the infection causes a mellitus, back pain with paresthesia and pain at the site of the bite are early reported symptoms in rabies. The prodromal phase lasts approximately 2 to 12 days. At this stage, the disease is 100% fatal. When the virus reaches the brain, more neurological deficits start to emerge. This is called the acute stage, where the patient develops an acute encephalitis. Depending on the virus, 2 forms of rabies can develop. Furious rabies, where the patient becomes agitated, experiences aerophobia and hydrophobia and mood changes such as aggressiveness and autonomic dysfunction and hypersalivation. The other type of rabies is known as paralytic. This type constitutes approximately 20% of the cases. The most common sign is sudden flaccid paralysis of the extremity that had received the bite. The paralysis spreads more quickly and the disease can at this stage be confused with Guillain-Barré syndrome. This is especially the case when the most pathognomonic signs such as aerophobia and hydrophobia are absent, which usually occurs in the paralytic form. The final outcome is the same for both forms: coma followed by death. It is important to take any bite or exposure with an animal seriously. Unfortunately, today the majority of exposures go unnoticed by the general population. The cause of this is the increase of rabies transmission from bats. In the U.S., the main transmitters of rabies to humans is the bat. Never touch a bat without gloves. If you see a bat inside your house and you want to remove it, always wear gloves and protected clothing. If you wake up to a bat in your room, always seek medical attention. Keep in mind that the microscopic laceration of the skin is enough to transmit the disease. Never reassure yourself by checking for bite marks. The absence of bite marks in the presence of a bat in a situation where you had been asleep or intoxicated by drugs or alcohol does also constitute a rabies exposure. If you touch a bat without gloves, keep in mind that the bat has claws on its wings. The absence of scratch marks after handling a bat is not a reassurance that no rabies exposure has occurred. Walking outside at dusk also brings some risks to be exposed to bats. Although very unlikely, bats can sometimes collide with humans. A collision with a bat can sometimes be mistaken as a collision with a moth or other insect, due to their small size. Not sure? Seek immediate medical advice. Keep in mind that rabies is 100% preventable as long as there are no symptoms. It is never too late to receive a post-exposure rabies prophylaxis. The incubation period is very long, but has a median of 3 months. There are a total of 14 survivors of rabies in the history of rabies, where one of them survived due to the Milwaukee Protocol, an experimental treatment where a cocktail of drugs such as ketamine and antiviral drugs were used. The disease kills annually around 50,000 persons, mostly in Asian countries such as India. Thank you for listening at Reality Check. Leave a like and subscribe if you want further reality checks.